Copyright 2018. Wolters Kluwer. Chapter 17. Nursing care of a postpartal family. Postpartal period, puerperium 6-week period after childbirth. Retrogressive maternal changes. Involution of uterus and vagina. Progressive maternal changes. Production of milk for lactation, restoration of normal menstrual cycle, beginning of a parenting role. Psychological changes of the postpartal period, phases. Taking in. Taking hold. Letting go. Parental attachment/bonding. And face position. Engrossment. Positive family relationships. Rooming in. Sibling visitation. Maternal concerns and feelings. Abandonment. Disappointment. Postpartal blues. Reproductive changes. Uterus. Lochia. Cervix. Vagina. Perineum. Uterine involution. Characteristics of lochia. Systemic changes. Hormonal. Urinary. Circulatory. Gastrointestinal. Integumentary. Retrogressive changes. Exhaustion. Weight loss. Vital signs. Temperature. Pulse. Blood pressure. Progressive changes. Lactation. Return of menstrual flow. Beginning of parenting role. 2020 National Health Goals related to the postpartal period reduce the maternal mortality rate to no more than 11.4/100,000 live births from a baseline of 12.7/100,000. Increase to at least 82% the proportion of mothers who breastfeed their babies in the early postpartum period from a baseline of 74% and increase the proportion of mothers who still breastfeed at 6 months to 60.6% from a baseline of 43.5%. Increase the proportion of live births that occur in facilities that provide care for lactating mothers and their babies from 2.9% to 8.1%. Reduce postpartum relapse of smoking among women who quit smoking during pregnancy, developmental. Increase the proportion of women who used contraception to plan their pregnancy. First 24 hours. Health history. Family profile. Pregnancy history. Labor and birth history. Infant data. Postpartal course. First 24 hours. Laboratory data. Physical assessment. General appearance. Hair. Face. Eyes. First 24 hours. Reproductive system physical assessment. Breast. Uterus. Lochia. Perineum. Palpating the uterus. Assessing a postpartal woman and family. Nursing diagnoses, the postpartal period, disturbed sleep pattern related to exhaustion from and excitement of childbirth. Risk for infection, uterine, related to presence of lochia and denuded uterine surface. Risk for fluid volume deficit related to uterine atony. Pain related to perineal discomfort, uterine cramping, after pains, or muscular aches. Outcomes: the postpartal period patient states she is able to sleep and feels rested during postpartal period. Patient's temperature remains below 100.4 degrees Fahrenheit, lochia is present and without foul odor. Patient states degree of pain is tolerable. Patient demonstrates knowledge of measures for adequate pain relief. Patient maintains vital signs within normal range, fundus is firm to palpation, lochia discharge is small to moderate with a minimum of clot formation. Nursing care during the postpartal period, relief of discomfort. After pains. Muscular aches. Hot and cold therapy. Perineal exercises. Episiotomy care. Nursing care during the postpartal period. Perineal care. Perineal self-care. Rest. Adequate fluid intake. Urinary elimination. Constipation/hemorrhoids. Assess peripheral circulation. Prevent/alleviate breast engorgement. Promote breast hygiene. Promote uterine involution. Preparing for discharge. Group classes. Individual instruction. Discharge planning. Postpartal examination. Woman and family with unique needs. Choosing not to keep child. Child remaining hospitalized. Adopting child. Question: a postpartal woman tells you that her room must be too warm because she has been perspiring excessively since delivery. Which of the following is your best response? You should ask for a cooler room. Breastfeeding will decrease the problem. I'll take your temperature before you feed your baby. You should maintain a good fluid intake. Answer: D. You should maintain a good fluid intake. Rationale: diuresis, including extreme perspiration, begins after childbirth to rid the body of excess fluid. Question: you assess a postpartal woman's fundal height every 15 minutes during the first hour postpartum. At which of the following locations would you expect to assess the height of her fundus? 2 finger breadths under the umbilicus. 1 finger breadth under the umbilicus. At the umbilicus. 2 finger breadths above the symphysis pubis. Answer C. At the umbilicus. Rationale: during the first hour postpartum, the typical height of the uterine fundus is at the umbilicus. Question: a postpartal woman is having difficulty voiding following delivery. What should the nurse expect as the most reasonable cause for the difficulty voiding? The bladder fills slowly following childbirth. She is not trying hard enough. She must have a cervical tear, reducing bladder sensation. Perineal edema makes voiding difficult. Answer D. Perineal edema makes voiding difficult. Rationale: as the fetal head is delivered past the bladder, edema of the bladder and perineum, which reduces bladder function, can occur.